Okay, well, welcome everyone, and welcome again to COSSA Headlines. Thank you for joining us. I'm Wendy Noss. I'm COSSA's Executive Director, and I'm pleased to welcome all of you to today's discussion, which will be a little bit different from what we've covered in the past. We may have some new folks on the line today, given the importance of today's topics, several topics. We thought that we would open up this activity to others in the science and technology community. So while this monthly activity is normally a member benefit, we have invited others in the science community to join today to listen to today's topics. So welcome to all of you. To give you just a sense, hopefully you can see my slides, give you a sense of what we'll cover today. We normally start with a quick overview of some of the most important news developments happening in Washington and the policymaking realm over the last month, and so we'll do that quickly. But we want to leave as much time as we can for our special guests today, which will be a discussion on a new NIH report on COVID-19 vaccination communication. And then we actually have two deep dive topics today. And the second being COSSA's recommendations to the Biden administration and our policy priorities for the coming year and next couple of years. So we'll end there. And then we usually like to end with some homework assignments for anyone who wants to keep the conversation going and be active this month. We have some things that you can do. So welcome, and we will dive into today's headlines topics. As I said earlier, this is usually a member only activity, but for those of you who are new from other organizations, if you're not currently a member, I just wanted to shamelessly plug that COSSA is not only open to social and behavioral science organizations, but we have lots of member organizations from around the country, different universities, different disciplines. So if this is an activity that you value, please do be in touch, and we can discuss how you might participate more in the future. Okay, so without further ado, let's dive into this month's headlines topics. All right, congressional news. So it seems like a lifetime ago at this point, but right before the end of the calendar year, Congress did pass, and the president finally did sign into law, the FY21 appropriations bills. And it was a bit hit or miss there for a couple of weeks, not knowing if the president would veto it or sign it. But the good news is we are starting the new year fresh with appropriations in place. So no government shutdowns, no more continuing resolutions. The appropriations were late, and that is always problematic to the agencies and programs that we care about, but it's done, so we don't have to worry about that heading into this next administration. In terms of the numbers, the appropriations for 2021 are largely flat, and with some modest increases for social science agencies and programs. It's generally good news. No major cuts to programs that we care about, so that's good. But it was a tough year with supplemental funding going out the door and budget caps and things that I think this is the best place where we could have ended up. So that's good news. Attention will now turn to 2022, and we will be anxiously awaiting the president's budget request, which will be the first under the Biden administration in February, but likely delayed, as is common in a new presidential administration. You can see all of the numbers and our analysis of the appropriations bills on our website, and invite you to do that. All right, turning to the executive branch, we wanted to flag that last month the U.S. Government Accountability Office, or GAO, released a new report reviewing the policies at 5 research agencies, federal research agencies, that these policies were put in place to secure federally funded research from foreign influence. Now, you may recall that before COVID, there was a lot of discussion across the federal government, even in Congress and among many of our organizations, around research security and different, Chinese institutes, conflicts of interest, other things. And so these policies were put in place across the government, and this new report is reviewing those at DoD, Department of Energy, NIH, NASA, and the National Science Foundation. They were evaluated on their existing policies for requiring researchers to disclose foreign conflicts of interest, including non-financial conflicts of interest, and their procedures for addressing failures to disclose these types of conflicts. And the findings of the report showed generally that most agencies have taken some action to improve research security, although there are some noticeable gaps, especially in the area of disclosure of non-financial conflicts of interest. You can read the report, and the link is on the screen there, but I will note that COSSA prepared 2 different hot topic issue briefs on research security in 2020, which really deep dives into this topic and how different agencies in Congress is addressing the issue. And so I would invite you to check those out if you want to learn a lot more on these topics. Okay, in other executive branch news, the Advisory Committee on Data for Evidence Building, which was established by the Foundations for Evidence-Based Policymaking Act of 2018, or the Evidence Act, which we've talked about quite a bit, issued a general solicitation recently for comments from the public to help inform its work. The request includes a set of 10 questions that cover core issues such as capacity needs for secure data access and record linkage, areas for research and development on state-of-the-art data access and data protection methods, how to protect privacy when using personally identifiable information or confidential business information in support of evidence building, how to promote transparency and facilitate public engagement with the evidence building process, and many others. And so this is an important next step in the development and implementation of the Evidence Act. Comments are sought in response to this solicitation by February 9th, and you can go to the Federal Register notice to see all the details and all of the questions that they're hoping to receive responses on. Okay, I'm gonna, that's my dog, say hi. I'm gonna skip this bullet for now because that is our deep dive topic, but I just wanted to show you the link to the report, which I'm sure will be shared with you in a moment. All right, turning to community news. So the National Academies has released a digital resource on how to communicate newsworthy social and behavioral science. The resource offers insights and strategies on a variety of communication topics, including the concept of newsworthiness, differences of background between journalists and scientists, common challenges facing the media in reporting on science, and suggestions for scientists and journalists to consider when choosing to communicate science. The information in the resource includes segments from a previously recorded roundtable event at the National Academies, and includes testimonials, checklists, and other resources. This is incredibly valuable, and I would encourage everyone to check it out on the National Academies website, as we're always, I think, grappling with bridging the gap between science and reporting on science. So check that out. Okay, I'm going to skip this for now, but here is the link to our recommendations to the Biden administration, and I will show that later as well. And finally, we wanted to remind you to check out our Why Social Science blog if you're not already subscribed to it. This last month, our December blog posts came from Kelly Craig Henderson, who is the Deputy Assistant Director for Social, Behavioral, and Economic Sciences at NSF. And she published a piece for NSF's Science Matters blog, and with her permission, we shared it with all of you through Why Social Science. And she discusses her experiences confronting stereotypes as an African-American female scientist, and talks about SBE NSF's new Build and Broaden program, which is directing resources toward researchers specifically at minority serving institutions, and it's a really new marquee program that NSF is promoting. So if you haven't seen that yet, you can go to whysocialscience.com and you can register to receive the blogs directly in your inbox once a month. Okay. I'm not going to pause for questions now, but if you have questions about any of those topics, they're always posted on our website and in our COSSA Washington update. But without further ado, I now want to welcome Dr. Sylvia Cho and Dr. Christine Hunter to COSSA Headlines. Dr. Cho is Program Director for, hold on, let me unshare. Okay. Program Director for the Health Communication and Informatics Research Branch at the National Cancer Institute at NIH, and lead author of NIH's recently released report, COVID-19 Vaccination Communication, Applying Behavioral and Social Science to Address Vaccine Hesitancy and Foster Vaccine Confidence. Dr. Cho is a fellow social scientist with a degree in linguistics, which we always love to see. And she's joined today by co-author Dr. Christine Hunter, who many of us know. She is the Deputy Director of NIH's Office of Behavioral and Social Sciences Research and is a great friend to COSSA and to our community. So I will now invite, I think, Christine, you're going to go first. And so once you pull up your slides, the table is yours.
All right, thanks. I think Sylvia's going to run the slideshow, and the truth is she's going to do most of the talking, but I'm just going to give an introduction. So thank you for the great introduction. Sylvia, we've got it on presenter mode so they can see the next slide and our notes. Not that it matters, but that's better. Thanks. So this is an effort that Sylvia and I co-chaired, and it really was a trans-NIH behavioral and social science effort. And we're really excited to have the opportunity to give you a little bit of information about this and kind of spread the word about the products. So next slide.
Oops, wait, hold on. I think I have to click. I can't, okay.
There we go. So this, this effort to really take a look at how the behavioral and social sciences can contribute. There's many ways, and I think some of you have seen, some of the research efforts that we've put on the street for social, behavioral, and economic factors. But we really also wanted to think about how could we take what we already know and really facilitate the adoption of these behavioral and social science findings in public health practice as it relates to the pandemic. The quote on the screen is something that Dr. Bill Riley had in an article a couple of years ago, but I hope you're seeing this more and more from NIH, this real recognition that we cannot leave our research findings at the water's edge and simply hope that others implement the findings supported by our agency. So this effort's in that spirit. I think we all know that the control of the pandemic has always had a significant social and behavioral component, whether that is wearing masks, maintaining social distance or washing hands. With the vaccines, even though we know that the heroic effort to develop and test these vaccines is crucial, the distribution is another massive challenge. But we still have the challenge of getting the vaccines from the freezers into arms. And that means thinking about social, behavioral, cultural, economic factors that are going to play a role. And one of those things that's crucial is how we communicate about vaccines. And so Sylvia's going to talk a little bit more about that. But the effort was to quickly come together as a NIH community and think about how do we put something out there that's practical and a resource for communicating about COVID-19 vaccination. And with that, I will turn it over to Sylvia. Thanks.
Thank you. Okay. Thank you so much, Christine, and thank you, Wendy and Julia, for the invitation to share a little bit about what we've done. The report is available for everyone to read and think about. So today I'm just going to give a little bit of a background of how it come together and a couple of sort of highlights and where we hope this can be a demonstration of the role social and behavioral sciences continue to play in public health, and especially in this devastating pandemic. By way of background, we formed a trans NIH working group very quickly. I think it was early September that we started this work. And on November 5th, we convened a working group, or an expert panel, I should say, with external experts in areas from anthropology, sociology, economics, to healthcare delivery services and health disparities. And you can see the name of the panel members on the right. We gave them kind of a highlight of sort of the critical context that we're working in terms of both general vaccine hesitancy and some specific concerns to this new and emerging virus and the vaccine, as well as the rampant spread of health misinformation. And I should say, on a personal note, that's how I got involved in this work. At NCI, I had been spearheading work related to social media and its utility for health communication, but increasingly we're being challenged by mixed quality information. And so I've been leading a number of research projects, and including a special issue at the American Journal of Public Health on this topic. And that's how I kind of stumbled upon the amount of vaccine misinformation and COVID pandemic related misinformation. In addition, there's been an increasing mistrust or distrust in science, as well as social divisions, biases, both in terms of personal biases, of information biases, to larger racial biases, and so on, to the politicization of vaccine. The role of emotions play a big role in how we listen to, receive, and act upon information. And needless to say, the disparities in COVID impact and outcomes have been very dramatic, and something that I think everyone is very concerned about, especially going forward with vaccine rollout. So what we did, instead of giving them a lot of questions, we just gave them 2 simple questions. What approaches can you and would you recommend to be brought to the table for government communicators when it comes to COVID vaccine information? We floated some ideas by them, such as the ones listed here, but we really wanted to be fairly open-ended and have them comment on what's worked in other diseases, health behaviors, and social domains. Secondly, we really want them to think a lot about tailoring and targeting, and thinking about the unique needs of various segments of the population, given the diversity of this country, to really think about high-risk populations, high risk for infection and high priority for vaccination, as well as now we see, I don't want to say low priority, but those who will not be getting vaccine as soon as some of the earlier phases ones. So this is the report, and I'm just going to use maybe 3 or 4 slides to give a little bit of highlights, and then reflect on some of the ongoing challenges and take questions. So we didn't feel like we need to spend too much time reiterating these 4 points, but I think it undergirds everything we hope to do. Communication cannot be successful if it's not coordinated and the messages aren't consistent. We also believe that trust building is critical, and I've been very gratified to hear this word in all the media reports about vaccination. You got to build trust, and you got to work with trusted entities, influencers, community leaders. We have to consider health literacy, and that's probably something everyone here agrees with, that not everyone understands and act upon information in the same way based on language, culture, literacy, and many other factors. And lastly, prioritizing equity in everything we do. This is not just equity in access to vaccine, but equity in information access and communication. We had 3 main, parts to this report. The first is the importance of defining the goals of communication. It's not always the same. Sometimes it's more about encouraging uptake. Sometimes it is really addressing hesitancy, filling in missing gaps in information. So we encourage communicators to establish first their top line messages, and then not just talk about vaccine safety and efficacy, but have a way of really articulating succinctly the vaccine development process and the monitoring distribution process. Hesitancy has to be addressed. It cannot be dismissed or judged upon in ways that make people feel turned off or feel that the overly directive language is not respecting their decision-making capacity. And we have to monitor the spread of misinformation and develop counter messages as well as mitigating strategies. And here we really highlight not every piece of misinformation warrants a counter message or a correction. There has to be a process of determining, the viral spread nature and the kind of, the dynamics of misinformation sharing. Lastly, vaccine messages cannot be divorced from overall pandemic control efforts, whether it's continued preventive behavior such as mask wearing and social distancing, or attitude towards policies and testing, work we do in testing and contact tracing. Secondly, we've emphasized, and this was something that came up throughout the entire 4.5 hours that we convened the expert panel. You got to meet the needs and listen to the community, your intended audience. And all of you in social sciences knows that there's no one size fits all way to communicate. So this notion of audience segmentation is critical. And we cannot have this top down, the CDC recommends this and therefore it is so, but we need to do more of a bottom up value concordant messages to consider the different needs and information needs and preferences of a variety of populations. And in our report, we highlighted some vulnerable communities that may require us to really be thoughtful in how we do audience segmentation. Lastly, and I think this is probably going to be hopefully the meat of the recommendations, is we came up with a number of strategies that we think are important to really create and disseminate tailored messages. Some of them included here are we got to partner with trusted information sources. We got to really not just have a message and then give them the mic and say, now you tell your community, but have them co-design the message so that this is something that reflects the value of the community or the intended audience. Is there a way we can establish through our communication for vaccination to be a norm and social norm? Is there a way we can do behavioral nudges for those who are, behavioral economists to think about ways we could creatively use, whether it's a hashtag or a sticker, I got the shot, or something to really think about ways incentivizing such behaviors. On the flip side, we need to avoid using languages that suggest mandates or requirements, because from the research on anti-vaccine or vaccine hesitancy, we see a large component of certain, say, libertarian thinking or different sort of ideology that is well represented. And so we think using mandate language may further entrench those beliefs. And so how do we convey unity and bipartisanship in that vaccination decision is not one that should divide people further? And how can we not be truthful and not exaggerate the benefits or portraying vaccine as a silver bullet? So I think the next few points are all sort of related to this idea that we got to meet people where they are, meet their values, and not causing more negative emotions. And those of you who are psychologists know well that positive emotions and negative emotions work very differently when it comes to health behavior. So the experts recommended really thinking about positive emotions. And the last one is probably not so much a social science discovery, but sometimes a picture speaks more than 1,000 words, and that's really important to get the message out clearly and succinctly. What we were really proud of is this little one-page do's and don'ts for people who are not interested in really delving into the social sciences literature, but just want to get a tip sheet. And it's been very nice to see a high level of consistency in the recommendations across media, journalistic report, community leaders, and social science scholars. However, I don't know in terms of in practice, in real life practice, how much of all the recommendations have been adopted. I've seen some evidence of it, but that gets to my last slide, and then I'll open it up for question. I think when we wrote the report, we thought a lot about hesitancy and building confidence, but as we have witnessed, the rollout has been slow and has been, there's been a lot of changing policies and guidance for testing and treatment, as well as vaccination. The distribution plans have been decentralized and varied across localities and states. The media environment is very fragmented, and that's not new. I think the information silos continue to exist, and the misinformation landscape is also moving. There are many messages and many messengers, and they're not always coordinated. There is definitely still a concern that there's a politicization of science and public health practice. And behavioral and social scientists are continuing to study vaccine hesitancy, resulting in new discoveries. So basically, we are putting a lot of recommendations out there while being mindful that the ground is shifting in so many ways. So I think that makes it challenging, but hopefully to inform us the right ways and right priorities for both researchers and practitioners. So I'll stop there and see if anyone has questions. And please, Christine, also jump in if I've missed anything.
Thank you so much, both of you. I can't state enough how valuable this report is. One question I have is, I'm curious what the sort of uptake has been with other federal agencies with regard to the report, and then are there ways that you have sort of a built-in set of emissaries here in the social sciences? Is there a way that our organizations can help reaching different populations?
You want me to take that, Sylvia?
Sure, please.
Sure. So it was distributed pretty widely within the government. So we were connected with vaccine communication efforts at CDC, talked with them, shared the efforts, HHS vaccine communication. And then we also focused on kind of distributing through NIH. What we've heard and been really gratified is to learn is that, the people that we've shared it with have then shared it with other people. So we've gotten, deans of public, health, various states have said, oh, we're sharing it with the people we're meeting, in state X, Y, or Z. So I think, again, our focus was on government communicators and then kind of thinking how they might use the behavioral and social science to then work with the, kind of next level communicators, whether that's state, public health, or organizations. So I guess I would just say we would love for you to take this, tweet about it, share it, if you think it would be useful to any of your communities. I mean, this is a government product now, so it's out there. Please use it, distribute it. That's what I'd say.
Yeah, and I would like to add also that I think I've heard a lot of social scientists feeling frustrated that, hey, how can we help? Put us in the game, and sometimes it's hard to know who the drivers of, where the messages come from. So I think there are maybe opportunities for local, because we see, it's a huge country and different states have different, and counties, even school systems have probably need help and don't know where to look for them. So I would also say, a lot of what we say is something that could apply to, not domestic, sort of more local contexts as well. So that's not our focus for the report, but I think if there are your constituents who have connections with the state health departments and county, it's a place where we could make this report also known and helpful.
I think that's really helpful to hear, just as a parent of an elementary school child, and receiving endless emails about how they're grappling and when we're going to return to school and how they're waiting for information from the state. I think it behooves me to share that information, with our local community. And I think when it comes to government reports like this, it's nice to hear, an author of a report say that, because we don't think about that. We think the government's taking care of it, the distribution is out there, the dissemination is out there, when in fact, I think at least when it comes to something this big, I think the onus is on all of us.
Right. And I think that level of trust in a personal relationship, I mean, we've seen this over and over in public health and in social sciences. If somebody even indirectly says this is something to consider, it changes everything.
Absolutely.
So, yeah.
Yeah. I'm going to ask Ben on our team if he could check the chat box for us and read any questions we might have.
I don't see any questions in the chat right now.
Okay, I have one directed towards me. Let me see if I can read this. It says, how can organizations create and disseminate these tailored messages and still convey that we are not offering personal medical advice? I want to avoid a mixed message like, here are all the reasons to get vaccinated, but consult your doctor before you get vaccinated. There's sort of a dichotomy there.
I think when we are talking about tailoring is something that can be so broad or so narrow. For the most part, luckily for vaccine, is unless there are certain specific medical concerns, pregnant women and other groups, I think there's been a little more of a mixed messages. I think generally the idea is the same top line messages that we can give to people, but maybe given in a way that's more tailored to their needs, is what I would say. Christine, do you have any additions?
Yeah, I agree. I mean, I think we really tried to walk the line, that there may be some groups or some reasons where vaccination isn't the right choice for somebody, but we wanted it to be done in a way where it was truthful, it was accessible, and it communicated the science and what we know about vaccines in a way that didn't over-exaggerate or under-exaggerate, that kind of thing. Mm-hmm. And so, of course, you have to walk the line about, ultimately some of those decisions are going to be between you and your healthcare practitioner. But as we're communicating in public health, thinking about making sure our messages don't do more harm than good was a big thing that we thought about. I hope that makes sense and answers what the question is about.
Thank you. And I'll invite others to chime in if they have questions. I have one, which I think is more out of curiosity, but when you had your assembled panel of experts, I'm wondering if you address anti-vaxxers at all. I know, anti-vaccine is an issue in and of itself. And I think there's a differentiation between those anti-vaxxers overall and not wanting, hesitancy related to the COVID. And so did that come up at all? And are there any interesting findings or angles that you guys talked about?
Definitely, I'll start. There was definitely a reminder that this is a different vaccine, and then the hesitancy cannot just be treated like hesitancy prior to 2020. And we need to listen to people's concerns and questions. And a lot of them have really legitimate questions. How can you do this so fast? This development. But we also know that disinformation campaigns spearheaded by some of the anti-vax communities, they're listening very quick. They're trying to figure out how to play in this space. And actually some of the social science findings about anti-vaccine rhetorics have indicated that there is a whole intention to drive divisions, cause chaos, and add to confusion. So I think the message is both that we need to be very treating COVID in a unique way, but also keeping our eyes out for more divisive disinformation campaigns coming out of the anti-vax groups. Lastly, I will say, panelists all say that a lot of the hesitant, the silent majority of the vaccine hesitant people are willing to they're still so the undecided voter, undecided, user of vaccine, if you will. That should be our focus. If there were really just staunch, refusers, that's probably not our best use of time. And as we now witness this slow rollout, I think we even more feel that we need to keep moving. We need to get the vials into people's arms. We can't try to convince a small fragment of the population at the risk of delaying things.
So interesting. I think those are really helpful differentiations too. I mean, just light bulbs are going off left and right for me, because this is not business as usual, right? It's not a business as usual report. These are things that, we have our own valley of death here when it comes to the messaging and what you're recommending and actually getting into the hands that can use it. So I am immediately planning to call my school board after this, of making sure that they're aware of the report. Let me check the chat box real quick and see if we have.
Yeah, it looks like we have a question from Ed Lebo. The journey to the vaccine involves more than just a yes-no decision to get the 2 shots 3 to 4 weeks apart. It involves information about availability, location, qualifications of the provider, safety of the point of care site, reliability of the information. How is messaging capturing these other information needs?
I think that's an excellent point. That's why we call it vaccination communication rather than just vaccine communication. We all agree that vaccines can't alone do the work. It requires all of the things that this participant has highlighted. Definitely, especially this accessibility. How do I get it? Where do I go back? And yeah, the 2 shots definitely complicate the communication and the implementation. So I think we made it clear in the top line kind of, that these are all important information. It's not just about safety and efficacy. Though I think there is a point, when you're accepting or confident of the vaccine, that these, the information will follow. But if you're not even sure, you're on the fence, then that's sort of the first step we have to cross. Christine, do you feel like that's adequate summary of what we've discussed?
Absolutely. It was kind of the idea that some of this is necessary but not sufficient. So how are we addressing the lack of confidence and the hesitancy, and still acknowledging that there are so many factors involved that can play a role, but an unwillingness is a barrier that none of these things can fix unless we're addressing them head on.
Thank you. Any other questions before we let our guests go? You can go ahead and unmute your lines if you'd like to jump in. Otherwise.
Oh, sorry.
Yes, please go ahead.
Hi, I'm a health educator with a medical society, and we're crafting our messages. And the good news is that I think most of the things that are in this report are consistent with the things that we've been thinking about our messaging. But what I would say is that there are so many organizations and so much information out there. How do we coordinate this to avoid information saturation, and not recreate the wheel, but get information out there that's a little more, tailored but consistent in general? And what do you think our role is as medical organizations, let's say, in contributing to this effort without overburdening?
So maybe I'll take that one first and then let Sylvia chime in. This is a huge issue, and actually we wrestled with it. Like, were we wading into a pool that was already so busy? Was it worth it? And we kind of decided that yes, it was, to really, as the NIH, to think about how do we summarize the science. But I think it behooves all of us that have a role in communication to be really vigilant to what's out there on the landscape. So the messages, you're staying aware of what's happening from the government, what's happening kind of locally. I think that's probably the best we can do in such a rapidly evolving emergency situation where we can't, if we were to all try to get together and coordinate in a perfect way, it might take too long to actually get out there, but yet if we're not paying attention to those factors, we're going to be tripping all over each other. So that's not a very satisfactory answer, is it? I wish that I had like the roadmap, but I think it is just staying vigilant to the landscape and what's coming out, so that we can be aware as we're crafting our own products or our own messages.
Thank you. That does help, and the report helps enormously. So I thank you again.
Thank you.
Okay, it looks like we do have one other question in the chat box here. And it reads, is there any research to suggest that scarcity of supply or difficulty scheduling a shot is actually driving down hesitancy, or is it deterring people further?
I actually, well, I think it's all happening in the last 2-3 weeks. So I don't think there's any literature except from the cancer screening literature that I'm more familiar with. Definitely ease of, access is the number one predictor. If the doctor says, have you scheduled for your colonoscopy, let me help you get it done. That's the number one driver of actually getting it done. So I definitely think access issue is concern. But this idea that maybe seeing how hard it is to get it may make people, I don't know. I think that's a really interesting question, and unfortunately, a question we have to think about, because really we're hoping supply and demand would work well together.
Yeah, I would say that everything I've seen so far is more anecdotal, not really kind of research results. But there is a lot of ongoing research kind of tracking people's attitudes and behaviors. And so my hope is that down the line we'll have information about this to inform the future. But unfortunately, it may not happen rapidly enough to help us tomorrow. But I think it's a very interesting question.
Yeah, I was gonna say the same thing, which is the postmortem is the wrong word for the situation. But I mean, the research that's going to follow on, this entire crisis is going to be fascinating, and possibly game changing too, when it comes to informing a lot of other future events, maybe existing diseases, disorders as well, and vaccination in general. All right, I think we've taken enough of your time, Dr. Hunter and Dr. Cho. We want to thank you so much for joining us. And you can drop off if you'd like. We have one more topic to talk about, but we wanted to really tell you how much we appreciate you.
Thank you for the invitation. Thank you.
Yeah, it's been a pleasure. Thank you. Bye.
Bye.
All right, folks. So if you're going to stick around for just another 10 minutes or so, I wanted to move into our what Julia on our team has dubbed the quick dive. So hopefully you can see my slides here. This was going to be our main topic of discussion for this month, but really thought once we saw the NIH report that would be valuable to you all. So hopefully you got a lot out of that. What we wanted to do is just make you aware of how COSSA as an organization is approaching our outreach to the incoming administration and our priorities going forward for the coming year or years. So you may have seen, if you're subscribed to our newsletter, that we transmitted a report to the incoming Biden administration through their transition team called Putting Social Science to Work for America, 10 Recommendations for the Biden Administration. The report is 12 pages, and it includes specific action items the Biden administration can take in its first 100 days, first year, first term. And the report itself has 3 overarching themes, which you can see here, and I'll talk a little bit more about them as we go. So many of your organizations have met with members of the transition team. We did as well. And when we met with them after the election, they told us that the incoming administration, the incoming Office of Science and Technology Policy, the incoming NSF officials, they do not need to be convinced of the value of social and behavioral science research. They get it and they're on our team, which is great, a beautiful departure for where we've been, you know, in times past. But what they did ask us for were tangible, tactical recommendations, shovel-ready ideas that they can implement in their first 100 days, in their first year. So last month, we responded with our report that includes 10 overarching recommendations and 32 very specific actions that they can take. And we included sort of a time frame for those as well. Are these day one ideas? Are these 100-day ideas, first year, first term, and so on? Our report is not a complete list. We had to sort of triage a bit, and our report could have been 100 pages easily. But it's really meant as a jumping off point for our work with the Biden administration in the coming months and years. So if there are things that are not in here, if there are recommendations that your organizations have that you would like to see COSSA implement, please share those with us, definitely, because we work to support the social behavioral science community broadly, and we're not wedded just only to this document. So the first general theme is the most general in terms of science and technology. It's really to restore trust in science and in government data, and I don't think I need to provide a history lesson at all about what we've seen over the last several years. The recommendations and actions included in this broad theme have a lot to do with the many executive orders and regulations and other federal agency activities that have been implemented in the Trump administration. We include an appendix in the report that lists many, certainly not all, of the executive orders and regulations that have been enacted and implemented that we'd like to see addressed. So that's a big one and very consistent, I think, with what a lot of organizations around town have been asking for. The second recommendation under this broad theme is to get back to the place of relying on independent, unbiased advisory committees and scientific advisors. There are plenty of examples from over the last several years of federal advisory committees that have been made partisan and political through appointments of people who are not qualified according to the statute of the advisory committee. There are lots of advisory committees and other bodies of advisors that don't exist anymore. And so we've outlined what many of those are and provided specific recommendations on how to improve the ability of the federal government to receive unbiased information from the scientific community. And the third recommendation in this area deals similarly with integrity, stature, independence, but related to federal statistics and data. The federal statistical system has been in trouble for years and years, mostly from benign neglect. Certainly before I came to COSSA, I was not well versed in the activities and the importance of federal statistical agencies. And so it's not surprising that there are others in the government who may not see the inherent value as well. So there's a lot of correction that's needed by the next administration to undo a lot of the damage to federal statistical agencies, to federal data, and so on. And so these tangible action items have to do with making sure that statistical agencies have autonomy over their budgets. Many of them are burrowed very deeply into other departments and agencies, and essentially setting up these agencies to do the work that they were created to do without political interference. So that's the first section of the report. The whole second section is to this incredibly important critical area of diversity, equity, and inclusion, both generally, but also related to the scientific enterprise. We use our recommendations here to make the point to the incoming administration that social and behavioral science actually has a lot to say about equity, inclusion, diversity within science and within society and policy making in general. So we didn't list all of our action items here, but to give you a flavor, some of the things we've asked for are a National Academies report, sort of a consensus study to develop a roadmap to address systemic racism in academia and the scientific workforce. Establishing an NSTC, so basically an interagency task force led by the White House to create an action plan for enhancing DEI in science, enacting legislation to address sexual harassment in science. There are all of these sort of scientific workplace issues, harassment related to diversity, sexual harassment, and so on, that have been addressed over the last several years, but not really. You know, lots of legislation, some reports coming out of the White House, but what we're really asking for through our recommendations are some actionable plans with money behind it to actually see some results in addressing these areas. We're also asking for the collection of demographic data that best reflects the American population. And this is across various agencies and different data collection efforts, but there's issues certainly with federal classifications of race and ethnicity. We saw this with the 2020 decennial census using old race and ethnicity classifications. There are needs to collect better data related to gender identity and sexual orientation in many federal agency data collection efforts at NSF and at other places. Standardizing the collection of demographic data across the R&D enterprise, making sure that the data can essentially talk to one another and data collection is consistent across the government. And then our third area is the meatiest for our report, and it's because it's all about us. It's all about the social and behavioral science community. It's about our expertise as a community, as researchers, and our experts and how they can all better embed throughout the federal government and in policymaking. And so we cover lots of topics in this section. There are three general areas we dive into. We had to say something about COVID-19. So we have action items and recommendations related to the COVID pandemic. Again, highlighting the value of social behavioral science insights in combating it. As we just saw with our deep dive topic, social science has a lot to say about this. So we have two sort of action items in this space. One is integrating social science expertise in the response and recovery planning now, but also remembering that once this is all over, once we get out on the other side of this crisis, social behavioral science is needed to understand what happened and to plan for the future. And so making sure that our expertise is being used throughout that entire process to understand COVID. We have several recommendations related to building scientific and specifically social scientific capacity in the federal government and in the executive branch and in the White House specifically. And so here we talk about key positions within the government that should be, if not filled with someone from the social science community, at least has someone or has a way to be informed by the social science community. So one example we came up with this year was to create a new role, actually, in the White House Office of Science and Technology Policy, a senior social behavioral science expert who would inform the OSTP director, inform the president, essentially be at the table to provide the social behavioral perspectives on lots of science topics, from COVID to climate change and energy usage and other things. And so you will find in that section lots of actions about specific positions within agencies in the government that would benefit from closer collaboration and utilization of experts in our fields. Again, we also talk about the statistical system and way to, for the Biden administration to become strong stewards of the statistical system. Again, appointing leaders in important places and elevating the statistical agencies within their own departments. The third piece of this third theme is enhancing the scientific and data enterprise. This is sort of a catch-all for a lot of the things that a lot of our organizations ask for every every year, funding for research. We talk about and we endorse a recommendation by others in the scientific community to double federal investment in R&D and in STEM education over 5 years relative to GDP. So doubling the amount of the GDP, percentage of GDP that goes towards research and development. And then we, of course, say that social science should have a piece of that increase and make the case that there are federal agencies that are currently undervaluing, I think is not strong enough of a word, but undervaluing social and behavioral science. And that in order to meet their missions, such as, the National Institutes of Health supports social and behavioral science, but certainly as we've seen with COVID and Ebola and other diseases, pandemics, crises, the social and behavioral piece is central. And so there are ways that agencies can enhance their support. And then our last recommendation, again, is about federal statistics and data infrastructure. Excuse me. And these are some very, very specific action items related to evidence building, the chief statistician, and others. So I would invite you to check all of those out as well. Okay, so we are going to end right on time. I wanted to say our transition document, as we call it informally, is available on our website. We included it in our COSSA Washington update last week, I guess. And we will be turning it into a shorter document. So those of you who engage on the Hill, we will be turning it into a legislative agenda, sort of a 1 or 2 pager. It'll be a central focus of our advocacy day. And so want you to save the date for COSSA's Social Science Advocacy Day virtual will be April 27th. Watch your inboxes for that information. Registration will open up fairly soon. But as I said earlier, in terms of your homework, if you and your organizations have recommendations that you don't see reflected in our document, let us know. We're happy to add other items to our legislative agenda to support your efforts if they're not specifically directly relevant to COSSA, but it would be helpful to have backing from our community. Just be in touch. We would be very happy to help lift all boats, so to speak. Mark your calendars. Our next COSSA headlines is scheduled for February 11th. Be sure to mark your calendars for every Thursday. We are continuing headlines throughout 2021. For those of you who are new and participating from other organizations today, if you found this activity valuable, get in touch and we'll talk about how we might engage with you going forward. And send us your ideas for deep dives. We focused a lot this past year on COVID, on sort of racial injustice and inequity issues because we thought it was appropriate to. But we would like to talk about other topics that are of interest to you as well. So don't be shy with those. If there are certain experts you want to hear from in the government or elsewhere, do let us know and we will set that up. I will stay on for another minute. If there are questions or you just want to chat, let me know. Otherwise, I hope you're staying safe and well. Spread the word about vaccine communication or vaccination communication and share the report. And we will see you next month.